my channel, One Loves Healthcare. For today's topic, we have scabies, a frequent contagious infection. We would be explaining in brief an overview in relation to its definition, the mode of transmission, the pathogenesis, the clinical features, diagnosis and a brief of its general treatment. A more detailed explanation for the topical and the oral drugs used by a healthcare provider will be given in a subsequent video. So, let's get started. Now, scabies is an intensely itchy dermatosis caused by the mite Sarcoptes, scabiei, var hominis. It occurs at all ages, but it is more particularly seen in children. The mode of transmission. It is highly contagious and the person-to-person spread occurs via the direct contact with the skin. There is a transfer from the clothes and beddings if it is contaminated by the infested people immediately beforehand. The pathogenesis. The infestation occurs when the pregnant female mite burrows into the skin and lays its eggs. After 2 or 3 days, the larvae emerge and dig new burrows. They mature, mate and repeat this cycle every 2 weeks. The main symptom of scabies are probably a result of the host immune reaction to the burrowed mites and their products. Now proceeding with the clinical features. Incubation period is typically 3 weeks. In cases of reinfestation, the symptoms can occur in 1 to 3 days time. A patient with scabies will complain of itching, which is more severe at night. Other skin manifestations include papules, blisters, nodules, and eczematous changes. These lesions commonly involve web spaces, the flexure surfaces of the wrist, axilla, waist, feet, ankle, portions of the buttocks, and genital areas. More details about the site and lesions in various genders and ages are as follows. In females, the itching of the nipple is associated with a generalized pruritic papular eruption which is characteristic of scabies. In males, an itchy papule on the scrotum and penis is virtually pathognomic. In infants and young children, scabies often affects their faces, head, neck, scalp, palms, soles and is often with a generalized skin involvement. Pathognomic sign is burrowing, the linear tunnel in which these mites live. These occur as a short, wavy, scaly, grey lines on the skin surfaces and are most easily found on the hands and feet, particularly in the finger web spaces, thenar, hypothenar eminences and also on the wrist. They are often missed if the skin has become scratched, but it becomes secondarily infected if an eczema is present. Secondary infections are likely to occur with Staphylococcus, Streptococcus or with both. The diagnosis. Scabies is usually diagnosed on history and examination. A definitive diagnosis relies on the microscopic identification of mites or eggs from a skin scraping of a burrow. A generalized treatment. It is important to treat all the members of an affected household at the same time. All clothes and bed linen should be washed at temperatures above 50 degrees Celsius. Items that cannot be laundered may be kept in a sealed plastic bag for at least 48 to 72 hours or in a freezer at -20 degrees for 72 hours. The detailed topical and oral drugs treatment will be explained in a subsequent video. Thank you for watching this video, and if you found this helpful, please consider liking, commenting and sharing it with your friends and family. Thank you.